right. So, as some of you may know, the nonprofit sector includes many different type of organizations with various missions, operations, and communities that they serve. In fact, there are too many for us to cover all of them today. So we chose 3 industry professionals from the voluntary health, advocacy, and charity or social service areas of the sector to give us an overview of their organizations and where they fit into the industry overall. So let's welcome Lance Slaughter, Senior Vice President of Governance and Volunteer Engagement for the ALS Association. Letal Zidkony, Director, Retention, Marketing, and Donor Services for Planned Parenthood Federation of America, and Katrina Mathis, Volunteer Services Director for Food and Friends. So thank you all for joining us today and welcome.
Thank you. It's good to be with you.
Thank you. Hi.
Great. So Lance, let's start with you. Can you tell us a little more about your organization and how it fits into the voluntary health, category of the sector?
Sure. So, hi, everybody. Good morning. My name is Lance Slaughter. I'm the Senior Vice President of Governance and Volunteer Engagement at the ALS Association. As Shelby pointed out, we are a national voluntary health organization with equal parts in terms of our scope is national, even though we've got a global research enterprise. We are a voluntary-led organization, and so we use volunteers throughout the implementation of our mission, through the governance of our organization and the implementation of all of our programs, whether it is using scientific experts to provide us guidance in terms of how we fund our research projects. We use advocates at every level of our advocacy efforts through public policy, as well as volunteers through the delivery of our programs and services, as well as through our fundraising efforts to ensure that there are sufficient resources to do the work that we do. The association mission is pretty simple. It's to discover treatments and a cure. And while we're doing that, empower people through advocacy, through our programs and services affected by ALS to live their lives to the fullest. The association a couple of years ago did set an ambitious goal, which is to make ALS a livable disease by 2030. For those less familiar with the disease, there are a few treatments that do extend life, but it is not a disease that people survive. And so we've decided that we wanted to put a stake in the ground and ensure that people could live with disease like they do with other diseases by the year 2030. In terms of what livable means, obviously, we're going to do this by 3 ways. 1, ensuring that we are finding and discovering more long-term effective treatments and cures. We also want to make sure that we're optimizing the kind of care that we're delivering today to avoid perhaps complications from living with the disease. And then finally, we want to take an active role in ensuring that we could either prevent ALS outright by at least attacking those things that we do know about the disease, or preventing the harms associated with having ALS. And we do all of those 3 things through these 3 critical enterprise areas. As I stated a few minutes ago, we have a global research program. Currently, we have 162 active projects around the world. We also provide support and services through programs to those living with ALS, as well as those in their family that care for them. We also partner with healthcare partners to establish a clinical care network throughout the country. Right now, we have over 100 clinics across the country that we partner with that specialize in ALS care. And then finally, we have a robust public policy effort, both at the federal level and at the state level, to ensure that there are no barriers for people getting programs, services, and resources associated with their care and their ability to live with the disease. So that's how we're structured with regard to delivering our mission. But as Pamela just pointed out, the professional staff that works at the association is diverse. And if I leave you with anything, is that if you were to do any work within the social good, including at the ALS Association, we have people here that are experts within their professional field across multiple things and perhaps some things you didn't think about. So obviously on the research side, on the clinical side, we have scientific and medical staff here at the association, but that also includes people that work in the social service area. We clearly have a public policy effort. So we have people that are specialized in both public policy at the federal level and all three branches, as well as those that have expertise at the state level. We have experts with regard to our communication and marketing efforts to ensure that there is significant attention to this disease, as well as providing concern and action to participate in other activities, whether that be public policy or perhaps our fundraising efforts. And then, of course, we've got those operational needs within our organization: data, information technology, human resources, finance. And so as you're thinking about your professional career and taking the education and the benefit of the learning that you're gaining through your time in college, there is a place for you in almost any national voluntary organization that is working in the social good space, whether it is health related or perhaps other types of causes. How's that, Shelby?
Wonderful. I think
Did I
that
stay
covers
within
it for me anyway. Does anyone
Okay.
have any questions for Lance? You can either post it in the chat or unmute yourself to ask out loud. No questions? I think that might mean you covered it.
Good to hear. Thanks.
All right. Yes. Let's go to you, Letal. Tell us how would you describe advocacy organizations such as Planned Parenthood?
Sure. First of all, can you hear me okay? Just a test.
Yeah.
Wonderful. So I want to say that I'm thrilled to be here today, and I appreciate having me here today. I wish I had this incredible resource out of college or during college to explore my opportunities. I certainly did not grow up thinking, oh, I'm going to be a direct marketer, a fundraiser. And it would have been incredible to have that guidance. And I'm truly already inspired just listening into Pamela earlier, sharing those incredible tips. And I want to reinforce the networking, reaching out and learning, because certainly almost everything I've learned and know today is from my incredibly smart colleagues internally within the organizations I've served, TNPA members, and so forth. So I want to start with the thank you. So because Zidkony, I use her pronouns. I'm with Planned Parenthood, and Planned Parenthood has a few entities under. Planned Parenthood is a big organization, and under Planned Parenthood, there's the 501c3, Planned Parenthood Federation of America, Planned Parenthood Action Fund. There's the PAC, and there are different organizations within, right? So Planned Parenthood Federation of America supports the affiliates, and there are approximately 600 health centers. And they serve all patients with care, compassion, and respect without judgment. We reach millions of people and patients through health centers, programs in schools, communities, digital resources, and really Planned Parenthood Federation of America and our affiliates are a trusted source for reliable health information that allow people to make their own informed decisions about their future, about their bodies, about their lives. And that is really the mission. The mission is to ensure that all people have access to care and ensure that they have the resources they need to make those informed decisions. It was founded in 1916 and is today one of the trusted healthcare providers, educators, and passionate advocates here in the US. And there's also a global entity as well. And right now, obviously, we're in a very pivotal moment where access to care and abortion is at risk. So we are all showing up. We've known that this moment is going to come and planned for it, and everyone is exactly doing that, showing up. And to Lance's point, we are structured somewhat similarly, right, where we have very, very diverse roles within, especially within Planned Parenthood Federation of America, where it's more health center focused and that's the care, versus 501c4, where that's advocacy and lobbying as well. So you have very, very diverse roles within Planned Parenthood, and you can certainly find your world within such organization. I hope that helps.
It does. Well, for me anyway. So any questions for Letal? Oh, we have one in the chat from Philippa. What's one of the most difficult aspects of your job as the director of marketing?
Is that for me, directed to me? I'm happy to start with that.
Yes, I think that's for you.
So there are the aspects of our role. So I'm happy to give a little bit of background of what I cover. I don't believe I've done that. So I oversee the acquisition, conversion, and retention of donors through multiple channels. So canvassing, mail acquisition, telemarketing, inbound, outbound, as well as I have experience with DRTV as well. So making sure that all those channels are set up and they're always prime and ready to capture the generosity of our donors, but also make those opportunities for those donors to support. My great focus and passion is sustainers, monthly giving, those donors who are generous to give a monthly donation, and their sustainers can also be annual, there could be quarterly, but the majority of the big programs who have sustainers are monthly donors. So that's the focus. I think the greatest area of the greatest challenges is, always to find that balance. So we want to make sure that we're diversifying our opportunities, we're diversifying our investment, and we have a healthy investment in those channels that provide the source for donors, right? So turning those levers, identifying those opportunities proactively and reactively. Another piece, now I don't want to take up too much time, but another piece is really within our external factors is turning those levers based on that, right? Our external factors can be helpful and support our efforts, but they can also be distracting. So I think for us to be able to identify that being ahead of it in terms of messaging, in terms of just having the vehicles ready for that is certainly something that is constantly a balance in what we do.
Great, thank you. And then Kevin had a great question. Can you speak a little about how your organization promotes work-life balance? And he makes a comment that I think we're all thinking I can only imagine how challenging it is working there during turbulent times. So that's for you, Letal.
Yes, indeed. So we've been going for a while. We were ready for the SCOTUS decision in June, and we had different scenarios of what that would look like. That being said, we were not ready for the leak in May. That I don't think anyone was expecting that. But because we had the foresight of having task forces and having those plans in place, we were able to hit enter and just execute on our plans. And that's exactly what we did. The question was about work-life balance. It's a lot, right? I mean, I think that we are so grateful. We had to go remote, and we are still remote ever since March of 2020. We had to up and leave and just have everything set up remotely immediately. And so that was challenging for sure, just having to reorganize everything. And I'm so proud to say that we've been successful. And that muddies the water between the work-life balance, right? Because you're always working, you're always there, but we have the support for Care for You days and understanding that this is a lot to carry emotionally as well as professionally. Do we have the magic sauce for that? I don't know, but there are definitely thoughtful efforts made from leadership to make sure that there's longevity and resilience in what we do, for sure.
Wonderful. Well, thank you, Letal. I'm going to jump to you, Katrina. Can you tell us a little more about Food and Friends and how you fit into the social service, category of nonprofits?
Okay, great. Thank you, first of all, for having me here, and to the other presenters. I'm learning so much. So again, my name is Katrina Mathis, and I am Volunteer Services Director at Food and Friends. We are a nonprofit based in DC, but we cover the 5,300 square miles of the District, Maryland, and Virginia. And what do? We provide home delivered, medically tailored meals and nutrition counseling to people living with HIV and AIDS, cancer, renal disease, poorly controlled diabetes, and other serious illnesses. We do all of this free of charge to recipients who qualify solely based on their health status and their nutritional needs. We believe that food is medicine, that anyone can get sick and everyone can help. We were started by volunteers in the basement of Westminster Presbyterian Church in Southwest DC back in 1988 during the HIV and AIDS crisis. Fast forward more than 30 years, we're in another building. We still have a great relationship with Westminster Presbyterian Church, and we expanded that client base to still include the HIV and AIDS clients, but then to all of the other people battling the other illnesses that I named. And what we still hold true to is that we were started by volunteers, and volunteers are the lifeblood of our organization. And we cannot do anything we do without volunteers. They are part of our production team, and they are here from 6 in the morning and they leave at 8 in the evening. And because we prepare medically tailored meals, they are in the kitchen with chefs. So there's opportunities, if you're paying attention, opportunity to have a culinary experience here. They prepare meals with chefs. We have volunteers who are working to slice and dice and puree and ladle and label and portion meals and help get meals out the door. We have people who help us to bag the meals. And then because we provide groceries and we provide freshly prepared meals. We also have volunteers who deliver the meals. They use their own cars, their own gas, and they deliver meals in DC, Maryland, and Virginia. We deliver as far north as Hagerstown, Maryland, and as far south as Fredericksburg, Virginia. So we have a pretty wide span there. We have some very committed volunteers, some who have been volunteering over 30 years. And even though there are a lot of opportunities to volunteer, there are a lot of other opportunities to build a career or start a career here. As Director of Volunteer Services, me and my team are responsible for making sure that we have enough volunteers on hand to work with the chefs, to work with the people who who bag the groceries, the people who bag the other meals, and to deliver to the clients. We have to make sure that we have this 6 days a week. We operate Monday through Saturday from 6 a.m. to 8 p.m. most days, and then 2 days a week we close at noon. The other thing that we do is we have on-staff dietitians. And so our dietitians help to create the menus. And then they work with our chefs to help make them tasty. We have people who oversee our clients, and they case manage the clients. So we have client services. We have nutrition services. Those are our registered dietitians who make sure that we are on task, making sure that every diet type, whether that's renal or diabetic or heart healthy or GI friendly or soft, pureed, whatever the diet type is, and we have about 13 of them, that they have all their nutritional needs met every day. And then we have a development side. These are the people who raise the dollars, because again, we do all of this free of charge. So we get grants from Maryland, DC, and Virginia. We have corporate dollars, foundation dollars, and then we have a host of individual donors. So we have people who oversee the corporate donations as well as people who oversee our individual donors. We have operations people. We have people who have to make sure all of this runs. And I would just say, if I left you with anything, it would be to a throwback to what your keynote talked about, is really getting to know yourself, getting to know who you are before you embark on a career. You know, I too thought I wanted to be a lawyer, but unlike the keynote, I was able to figure out in college during the constitutional law class that I had no interest in law. It was a terrible class, and I worked with the professor to get out of that class. But what I did was I went to the Peace Corps after college. I graduated from University of Georgia. I went to the Peace Corps a year later, and I lived in West Africa for 2 years. And I lived in a place where the culture wasn't like mine, the religion wasn't like mine. It was a polygamous society. They didn't speak the language I spoke. I had learned to speak the language, and it was 2 of the best years of my life. And it gave me a worldview. It gave me the cross-cultural skills and awareness that I have. And it gave me a greater appreciation for diversity, my own and then that of others. And so I bring that to whatever I do, and I see life through those lenses. And I know that it has definitely helped me. And so I would say anything that you can do that allows you to get to know yourself better is going to make you better, especially in your life, but especially in leadership. One of the worst experiences, I think, is when you have people in leadership who don't know who they are. It is who lack self-awareness. It can be oppressive. And so as you climb this career ladder, as you climb the ladder of your life, put you on your to-do list so that you are, I would say, making the time, not just for self-care, but for introspection, to figure out who you are, whether that's journaling, and to know where you want to go. Because you can get somewhere you don't want to be, just be smart enough to say, you know what, I'm on the wrong road, let me go over here. And that's okay, because we're all going to mess up in life, and we're not going to always land where we should be. But know yourself well enough to say, whether it's a relationship with a significant other or relationship with a job, know that, hey, this may be great for me, or this may not be great for me, and that's okay.
Oh, wow, that's great advice. You guys are just throwing it at us. I love it. And I have volunteered several times for Food and Friends. It was a great experience. I encourage anyone in this area to do it at least once. You really do have like a well-oiled machine going there. The operation just goes, and the people that you meet are amazing. So yeah, so thank you for that, Katrina. Are there any questions for Katrina? Let's see, Philippa has a question. Yeah. I know you mentioned that one of your responsibilities is to make sure that there are enough volunteers available. I'm curious on the strategies used to encourage new volunteers, as well as how this organization supports those volunteers who have been there for years.
That's a really good question, Philippa. So what I will say is one advantage that I have is that my entire career was in recruitment prior to coming here. When I left the Peace Corps, I went into recruitment for the Peace Corps, and then for AmeriCorps later. So my entire career has been with the federal government. And it helped me coming here, but it wasn't why I came here. I came to get out of recruitment, actually, but COVID actually created a situation where we lost a lot of volunteers for very obvious reasons. Some people went and sheltered in place and never came back. You had a lot of the school groups that stopped coming out, and then corporate groups who we relied heavily on during the day. Well, when they were working remotely, they weren't coming together. So when I first got here in 2019, we had about 8,500 volunteers a year. The year of COVID, it went down to 5,400. And then last year, it was under 3,000. So we've seen a significant dip, which is why your question, Philippa, is so important. What I started doing was really digging back into my old toolkit for recruitment, which is why, again, going back to your keynote, when you are in different spaces or when you have different opportunities, learning as much as you can, because you never know when you're going to need those skill sets again. And so it is not, I don't have this huge recruitment budget like I would if I was, a recruiter, but what I have are interns, and we have people who go and collect information from surrounding colleges and universities. We go look at civic groups, and we get all of this information, and we do email campaigns to them, letting them know about this caring community of people who are caring for people who need food and nutrition, they need services. We make sure they know that. We have social media campaigns that our communications director leads. And then we also go back to the groups. We have people who have been here who haven't come back. Well, we have all of their information. So we reach out to them and slowly, or we have been reaching out to them and slowly they have been coming back. So it's a multiple or a three-pronged approach that we have going on right now. But a lot of it before was word of mouth and we didn't have to do this. So this is really about us getting out and getting the word out about the need. Most people used to, and when we get to people now, they say, oh, we could never get in there. And you couldn't. It was really hard to get in here now. Before, it's not as much. So really just word of mouth, email campaigns, social media campaigns, and then reaching back to people who've been here before to let them know that we need their help again.
Awesome. Thank you for that. And so last question is for all of you to answer is, what's one thing that makes your organization or the type of work you do unique or different from the others on the call? And what's one thing that you feel like you have in common with everyone on the call? So whoever wants to jump in.
I'll jump in first. Obviously the nature of our disease, it's a fatal disease, so it certainly is different than the other challenges that both Katrina and Letal are addressing. Having said that, the one thing that I would say, and I guess you did a terrific job of curating this panel, Shelby, is that we all have urgent missions and causes. We're all going through a tremendous period of change. And so the one thing that, and I'll speak for myself and let Letal and Katrina speak for themselves, is that I get up every day recognizing that someone yesterday and this morning is going to learn that they're living with this disease. And I have all kinds of motivation to bring as much energy and effort to my work every day. I've now been with the association for 13 years, been in the nonprofit space for 24, and that's never left me. And that's somewhat unique because prior to that, I was in the private sector and I had a career 18 years, and I did not feel that way every single day. And so if I were in other spaces like addressing food insecurity or providing agency and autonomy about my healthcare, like Planned Parenthood is doing, I would feel the same way. Again, I'm going to let them speak for themselves. But what is somewhat unique about the social good space is that motivation and catalyst to do the work every single day, even when it's challenging.
Great. Who's next? Anyone else?
Letal?
Sure, I'm happy to. I think we're more similar than different. I think if I had to, the first thing that comes to mind is really maybe the structure, right? Again, as I shared, the way we're structured at Planned Parenthood, we have the different hats that we wear, and we have very clear borders between, right? There are certain things that I can say within our 501c3, certain things that I can say within our 501c4, and that's learning to wear the different hats. But even within that, right? Because the balance of how you budget for a different entity, how you market for within a different entity, prioritization, all those experiences and skills are also shared within even the market. If we talk about development and direct response and marketing, right? So you have to balance those priorities even within the type of giving. So one time versus monthly, where do you invest, right? So all that to say is that I think we're mostly more similar than not with our structure, with having the diverse roles. Still, everyone within is a change maker. We're all change makers, right? And that's why we're here. We want to do good. We want to make a change. We're all very passionate about our cause. There's always a need. So yeah, I would leave you with that.
Oh, that's awesome. How about you, Katrina?
I totally agree with both Lance and Letal. I will say that Food and Friends is different in that we provide medically tailored meals to people battling serious illnesses. I don't know of any other organization that does that in the DMV. Meals, food, yes, not medically tailored. I will say that we are the same for the very reasons that Lance and Letal pointed out. We're change makers. We are driven by seeing the impact that we're making. You know, when I would come in, I work upstairs is an industrial kitchen. And every morning when I come in, I'm reminded why I am here and the impact. I get to see the immediate impact of our work on people. And then when you do a delivery or you see a client and they talk about how their health has improved since they got on our service, I mean, that's it. You know, you feel very rewarded in what you're doing. And I think that's important. I think, you know, you can be driven by money and there's nothing wrong with that. But also to be driven by making an impact, making a difference in the community. I think that's what we all have in common.
Wonderful. And I think you wrapped it up perfectly. Basically, at the end of the day, we're all nonprofit. And like you said, Letal, we're all change makers. So I love that.
Yeah.
Yeah. So thank you. I just want to thank you all for being here today. Letal, Lance, Katrina, it was a really awesome conversation. And thanks for giving us an overview of some of the many fields within the nonprofit industry for everyone here today. So next, we're going to have a fun hands-on activity and a nonprofit, show you a nonprofit job searching tool demo that you don't want to miss. So before that, we're going to jump into reason 2 to start a career in nonprofit. And thanks.
Thank you.
Thanks, Lance. Thanks, Letal. Thanks, Katrina.
Thank you.